Welcome to HBCU Resiliency, Better, Stronger, and Prepared. Good morning. My name is Michelle McGriff. I am an Equal Employment Manager in the U.S. Department of Homeland Security. I am also a proud alumna of two HBCUs, Spelman College and Howard University School of Law. Today, I have the distinct honor of serving as your moderator. Our panel has representatives from the HBCU community, the private sector, and the federal government. They have extensive experience in emergency preparedness and disaster management. Each will speak on the topic of HBCU resiliency in their presentations. After the last speakers, we will open the floor to take questions from our audience. Please use the chat box to post your questions for the panel. Our first speaker, Dr. Gulda Downer, is an associate professor in the College of Medicine at Howard University. She heads the Howard University Telehealth Training Center. Dr. Downer is a co-founder of the HBCU Emergency Management Workforce Consortium. Dr. Downer, I yield the floor to you.
Good morning, Michelle, and thank you. And thanks also to the White House Initiative on HBCUs for this opportunity to represent Howard University and the HBCU Emergency Management Workforce Consortium. I'll be talking just a bit about how disasters impact our vulnerable populations and where our HBCUs are relative to their response and mitigation plans, and the whole community mandate, how HBCU's Workforce Consortium on culturally competent Cert becomes an important factor into our work. The next slide, please. The next slide, the next one, thanks. The National Oceanic and Atmospheric Association, I should say, administration rather, has pointed out that this year from January to June, a total of $8 billion weather and climate disasters impacted the US, and we were just halfway through the year. Hurricane Ida had not yet even been an embryo. The next slide shows that, as you can see, the number of disasters and their impacts has continued to grow exponentially over the years. This vividly illustrates the impact of climate change and the urgency of mitigating it. The next slide shows that floods has outplaced all of these natural disasters. If you follow me to the next slide, you'll notice that the US is second only to China in the occurrence of disaster subgroups over the past 2 decades. You'll notice that biological as the 5th subgroup is missing from this chart and should be included. Just think Ebola, COVID-19, and other infectious diseases. And while data provides an aerial view, this is what disaster looks like up close and personal in our communities. The next 3 slides, please. Now know that the impact of disasters, especially on vulnerable groups, is a death sentence. One more. Thank you. The next slide shows where our HBCUs are. Almost 60% of them are located in the southern states. According to the FEMA 10 regions, we do not have HBCUs in FEMA Region 1, 8, and also FEMA Region 10. Now, the southern states are also likely the ones most to experience significant natural disasters and associated hardships. Last year, with support from the White House Initiative on HBCUs, we distributed a survey to query HBCU leadership about their safety plans for the fall 2020 resumption of on-campus activities. The next slide, 2 slides rather, show and give a peek really into a few of the responses. This slide shows the institution's specific disaster protection needs. And you'll notice that natural disasters, again, in concert with our findings, is a concern for HBCUs in that region. Pandemic and infectious diseases, a heightened sense of COVID, so that's not a surprise. But what was surprising to us was the man-made disasters. And those were further categorized as riots and civil unrest. That was a concern for us since many of our HBCUs reference to that as a concern. And that's something we really need to pay attention to. Also, we had technological shortfalls and, of course, financial issues that came along with it. The next slide is very instructive. The emergency manager, as a key contributor to the recovery process, you will notice, is absent from this slide. This professional can play a critical role in both pre-disaster mitigation and post-disaster recovery, both of which are important to the efforts required to establish long-term resilience in our HBCUs. So the concern then is, without this person to connect us to our local, state, and federal resources, our HBCUs may not be able to get the resources they need to function well. Where do we go from here? We know that African Americans are underrepresented in the emergency management field. And FEMA's data show that of the 743 emergency management Homeland Security programs nationwide that are listed on their websites, only 9 are from our HBCUs. So until our HBCUs can offer more degrees in the field of emergency management, we plan to use Cert as our stepping stone. The HBCU Emergency Management Workforce Consortium was established to fill that void. We are working to prime the emergency management pipeline by getting our students involved in this field. We hear a lot about diversity, equity, and inclusion. Well, this is a myth if our community is not qualified to be included, because then we can't be included, there will be no diversity, and of course, the opportunity for equity will not be there. So what is Cert? Cert educates volunteers about basic disaster response, fire safety, light search and rescue, team organization, disaster medical operations. What it really does is to say, when a disaster occurs, the first person on the scene is the first responder. The Cert training frees up the professional responder and allows them to focus on more complex tasks during a disaster because the community is helping. Cert was really formed in 1985, and if you ask me, it is a well-kept secret. Because the next slide shows where we queried our HBCUs last year about Cert on their campuses. Only 25% had a Cert. And when we delved a little deeper, more than 40% of them shared that there was Cert, but it was not active. Now, for Cert to be more robust, it needs to be expanded and have cultural competence embedded throughout the entire training curriculum. The HBCU Consortium, the final slide, our initiative, the broader initiative for the consortium, is to educate and train at least 10% of our participating HBCUs. We want to include both the students, faculty, and staff for emergency response and management. Our target date for that 10% is 2025. If we have HBCUs on this at this session, I'm asking you to send us a note. Let us know if you have Cert on your campus and if it's an active Cert. And if you don't have Cert, let us know that you're interested in getting it on your campus. We also want to obtain funding for ongoing Cert training programs for HBCUs. And let me say a little bit more here. You know, there's a lot to learn from our HBCU communities, since these are the neighborhoods that have been under societal and environmental threats for centuries. And while this may seem like an intractable problem, for these communities, this struggle is nothing new. They know that no one is coming during a disaster, and they have developed innovative survival skills that belong in an integrated culturally curriculum training program. What our next focus is on to establish a center of excellence and also to create culturally competent emergency management curricula for our HBCUs. Let me just say this, a modicum of willpower at the federal, state, and local levels, along with that of our HBCU leadership, our students, and our community, can go a long way in making our HBCUs disaster resilient. The future of our generations truly, truly, truly depend on our actions now. Thank you.
Thank you, Dr. Downer, for your presentation. Our next speaker, Mr. Michael Burns, is the founder and executive director of the nonprofit company Community and College Partners Program. He is also a co-founder of the HBCU Emergency Management Workforce Consortium. I yield the floor to you, Mike. Thank you.
Thank you, Michelle. And again, I'd like to also thank the HBCU conference for allowing us to make these presentations and all the participants who have taken their valuable time to listen, learn, and get information from the presentations that we provide. My name again is Michael Burns. I'm the founder and executive director of the Community College Partners Program, or C2P2. Slide. So, there are many issues and concerns that surround emergency management and emergency preparedness. But right now, we're in the grips of a global pandemic that impacts all of us, but it disproportionately impacts our community. We took a look at one particular aspect of that we thought was never properly examined, and that was the impact that the lack of access to broadband had on COVID-19 death rates and other health outcomes. Since we know that the lack of access to broadband is more prevalent in our community than other communities. There's a case study that we developed to take on using the state of Georgia as the case study, and we took a look at COVID-19 death rates in rural minority communities. We also took a look at the issues, and then we put together some solutions, and we'll talk about resources at the end. Georgia is home to 10 HBCUs, and with the exception of the HBCUs that are in the Atlanta metropolitan area, these HBCUs are all in rural parts of Georgia. Slide. Oh, go back one, please. As you can see from this map, everything in blue is rural. Georgia has 157 counties throughout the state, and with the exception of the Atlanta metropolitan area, most of Georgia is rural. So when we talk about rural Georgia, it is most of the state. Slide. So by way of background, COVID-19 global pandemics had a devastating impact on the country and indeed the world, economically, educationally, and health issues. And the lack of access to broadband has an impact on the ability to get good health information and have access to telemedicine. But this impact isn't necessarily evenly dispersed. While only 1.2% of urban Americans lack access to broadband speeds that allow them to get the information and access telemedicine, 17% of rural Americans don't have proper access. And furthermore, 21% of patients on Medicaid don't have access. This is 21 million Americans that don't have access. So in the summer of 2022, we were allowed the opportunity to work with some students from Emory University to take a look at, is there a correlation between the lack of access to broadband, COVID-19 death rates, and other health data? Slide, please. So this is a basic summary of the tables that we'll show. We found that the COVID-19 death rate for all counties in Georgia was 99% higher for places that had access versus those that didn't have access. Those that didn't have access was 99% higher. When we took a look at all African Americans in the state of Georgia, and about 40% of the population of Georgia is African American, for those African Americans that had access, that didn't have access, their death rate was 203% higher than those that did have access. And it wasn't the only factor that was impacted. Infant mortality was higher and diabetes rates were higher. When we dug into the data even further and compared the death rate, the COVID-19 death rate for African Americans in rural parts of Georgia who were poor, considered below the poverty line, and lacked access to proper health care in comparison with white members of the population of Georgia who had good access to health care, were middle class, that COVID-19 death rate was 783% higher. And I actually had to check the data to make sure that was right, but that wasn't the only thing that was impacted. Again, infant mortality was higher and the diabetes rate was higher. Slide, please. These are the tables of the data that laid out the differences that we talked about. This will be available when the slides are available, but you can take a look at table 3B, and it talks about that 202% higher COVID death rate for African Americans throughout Georgia, simply based on the one factor, the lack of access to broadband. Slide. This is the slide where we included all different factors. It included minority, rural, poverty, lack of access to healthcare, and you can see in the red square, 783% higher COVID-19 death rate. This is based on data we got from the state of Georgia, from the Rural Center of Georgia, and from health agencies throughout the state. So these numbers are all data-based, and you can see there are other factors that were also higher also. Next slide, please. Having put together the data and provided presentations, we went back to the Rural Center of Georgia and to the state legislator and provided certain recommendations that they needed to do to help address the issue. Improve on hospital board governance is one of the things that we wanted them to take a look at. We wanted them to emphasize the use of a rural hospital tax credit system, a system that allows citizens to make contributions to rural hospitals and get tax credit for it. We told them about the need to strengthen the primary care referral system. And we also told them to prepare for the retirement of aging physicians in rural Georgia. Most of the physicians in rural Georgia are older. We, in fact, told them that they needed to prepare 2 years before they actually retired to make sure that replacements were not only in place, but understood the issues and understood the population. And at the same time, they needed to find ways to help decrease the caseload. Georgia's had 10 rural hospitals close over the last several years, has significantly increased the workload for the remaining physicians, and the state has a responsibility to try to find ways to help address that. Slide, please. We also wanted them to take a look at the true extent of the lack of access to broadband in rural areas. When we looked at this last summer, the information we had said if one home in a block had access to broadband, that all the homes in that block had access. And we know that that's not necessarily true. So we went back to the state of Georgia and asked them to take a look at ways to help improve the quality of that data, which they have done. They have invested funds and completely remapped the state of Georgia to get much more granularity as far as the extent, the true extent of the problem. And in fact, the National Telecommunication Information Administration has also revised their map, and it's a much more accurate picture of the lack of access to broadband. We also talked about the fact that this is a one for all and all for one resolution. It's not just the federal government's responsibility. States have responsibility, local governments have responsibility, business sponsors have responsibility. In fact, those that are working in the telecom industry, they also have responsibility. Everybody should be coming together to help to try to address this issue, because one group can't do it. Everyone's got to be able to work together. Based on what we discovered in Georgia, we decided that we would continue to do some additional studies in South Carolina, Louisiana, and New Mexico to see if it had more of a nationwide impact. And this study is available on our website, c2p2works.com. Slide, please. So we subsequently have completed the evaluation of the data in South Carolina and find that the results were very similar to what we found in Georgia. We worked with the University of New Mexico and the University of Utah to take a look at counties in New Mexico with significant Native American populations and found that the single biggest negative factor was the lack of access to broadband, more than poverty, more than race, more than any other factor. In Louisiana, we worked with Grambling State University to take a look at all the parishes across the state and found that low broadband coverage not only impacted the COVID-19 death rate, but it had a significant impact on other poor health outcomes in all those areas where there was a lack of access to broadband as well as poverty. And efforts are underway. We're continuing to expand this effort in Arizona, in Wisconsin, in Alaska, and we've got some communication with the state of New York to continue to do this study. In Wisconsin and Alaska, those studies are beginning. Arizona, we plan to begin in the next 60 days. In New York, we're in conversations to begin that work. Slide, please. There are resources available to help address this issue. The Department of Commerce's National Telecommunication Information Administrations have released a notice of funding opportunity for Connecting Minority Communities pilot program. It directs $268 million to expanding broadband access and connectivity to HBCUs, tribal colleges, and other minority serving institutions, and also allows the consortium approach, which includes minority businesses and tax exempt 501c3 organizations. That NOFO is available as we speak, and the deadline is midnight on December the 1st of this year. Next slide, please. Agriculture Secretary Tom Vilsack has announced that USDA is investing $167 million in 12 states to help address the broadband infrastructure issue. And I want to read a quote from the Secretary when this announcement came out about this funding. He said, generations ago, the federal government recognized that without affordable access to electricity, Americans couldn't fully participate in modern society and the modern economy. Broadband internet is the new electricity. What he's saying is broadband is infrastructure. It's not nice to have. It's not just for downloading movies. It's a vital part of every community's ability to be able to improve their health outcomes, their economic outcomes, and we all know the impact it's had on education. That particular funding will benefit rural people in the states of Alaska, Arizona, Colorado, Georgia, Missouri, North Dakota, Oklahoma, South Carolina, Tennessee, Texas, Utah, and Virginia, where we have HBCUs that will be able to take advantage of this working with communities. And it's part of a $550 million program being reauthorized by Congress as part of the Reconnect program with USDA. Slide, please. Thank you for allowing me to present this information to you, some recommendations, and we hope some resources that everyone will take advantage of to help address this critical issue. Thank you. And Michelle, I return it back to you.
Thank you, Mike. Our next speaker, Dr. Kevin Kupis, is the chair for the Elizabeth City State University Department of Aviation and Emergency Management. He is also a member of the HBCU Emergency Management Workforce Consortium. I yield the floor to you, Dr. Kupis.
Thank you, Michelle. Next slide, please. So thank you, Michelle, and thank you for everyone who's joining us today to give me the opportunity to talk about three of my most favorite subjects to talk about: preparedness, resiliency, and the success of our students. A little bit of background about Elizabeth City State University and the emergency management program that we have here with the Cert program, the Community Emergency Response Training. We're a fairly new program. We're officially 3 years old. And we started this because, one, there was no area in Northeast North Carolina for emergency service workers to get a 4-year degree. And two, we really believe in the idea that our emergency services, all of them, should mirror the communities that they service. And so we went into this with those two ideas. And with those two ideas, Community Emergency Response Team really comes into play, because that is, just like Dr. Downer talked about, that is the neighbors helping neighbors. That is us teaching the students to be good stewards of their community and how to progress and make the world a better place where maybe our generations could have done a little bit better. We want them to do. This becomes a huge workforce for us to be able to tap into in order to be able to help us on our campuses and universities be safer and more resilient, but also to make that mark that we should be making in the community to help them become more community and more resilient and more prepared as well. Next slide, please. And so when we talk about the Community Emergency Response Team, we have to get people to understand what it is first. We are not replacing firefighters. We are not replacing paramedics. We are there to help supplement that. We've seen from the storms in the last several years that there are getting more frequent and more severe, and we're going to have to step up our game a little bit. So we need more people to be able to deal with these type of issues. And again, we want these services to mirror the communities that we serve. And so the first thing is we have to get our community and our colleges and universities to understand what CERT is. And again, that neighbor helping neighbor type of thing, that being able to go out there and teach other people to be prepared and resilient, is a huge game changer when we start talking about resiliency. Because if we look at it honestly, we're not as ready and prepared for disasters as we should be. And we can pretty much put this at an individual, a family, an organizational, and even a community type of level. We could be more prepared. But to do this, we need more people to help. So if you're going to start a community emergency response team on your campus, which I would advise for everybody to do, you don't need to have an emergency management program on your campus for this to work. Because again, remember, this is neighbors helping neighbors. In emergencies and disasters, it takes a village to recover from this type of an event. And like I tell my students all the time, whether they're an emergency management student or not, you tell me what you're passionate about in life, and I will tell you how you can relate that back to helping your organization and community in time of needs. So this is good for everyone. So if you're going to do this, the first thing we have to do is get administrative buy-in. My organization, we did this fairly easily. The first conversation I had was with our attorney, Mr. Goodson, and he was our biggest proponent and still is the biggest proponent. And he's like, let's do it. This is not the case with a lot of places. You know, we're talking about doing CPR, we're talking about first aid, fire extinguishers, we're talking about things where people could potentially get hurt if it's not done properly. So we start running into these liability type of roadblocks that could occur. So we have to make sure that we train the administrative bodies how we're going to do this and how we're going to do this safely and effectively. And then from there, we went up the leadership chain. In my institution, Dr. Ward, our provost, she's a huge advocate. You'll see a picture of her learning how to use a fire extinguisher in just a little bit. And then Dr. Dixon, our chancellor, has probably been another big proponent for us. You probably have even seen letters from her to your HBCU saying that if your HBCU needs help in developing a Cert program, we're here to help you. And so I want to extend that handout again to say that if your institution is thinking about doing a Cert program, we're here to help you. And the Workforce Consortium has actually even put together a toolkit that we are more than willing to share with you as to how to become Cert and get registered with FEMA and everything else that you need to do. And then once you do this buy-in, then you got to find that momentum and keep that even through stages such as COVID. And remember that the turnover rate for our students is hopefully high. Hopefully we see our students for 4 years, they graduate, they go somewhere else and they do what they want to do. So we have to have a plan for this, and we have to have energized staff and faculty members that are willing to carry this on to the best of their abilities and keep moving this forward in order to be able to keep the program afloat. And we've been very fortunate at Elizabeth City that we've had a lot of faculty and staff buy-in. In fact, our assistant advisor for the Cert program is actually one of our librarians who not only learned the Cert program, did all the Cert training, is able to help his neighbors, but he went on and got his instructor license for Cert, and he's actually now teaching a lot of our Cert programs for us, along with some of our students who have done the same thing, which is really kind of cool. In this picture here, you can see these are some of our Cert students. They're actually planning what would happen in a major disaster on our campus, and they're looking to see how they would actually do mass sheltering and things like that. Next slide, please. So when we look at challenges, we also have to look at the solutions. And I got to tell you, we've been very fortunate in the fact that most of our solutions come in the form of friends. We have old friends, we have new friends, we have friends that we didn't even know were our friends until we needed help. And the amazing thing when you start talking about a community emergency response team, when you start talking about you're going to put together students to be able to help not only the university, but the community that the university serves, the friends come out of the woodwork. If you have a problem, if you have a need, you can go out there and you have people that are willing to share and help and come up with ideas. And along with that comes that plan, and make that plan and share it with those collaborators that you have. And a lot of times they're going to add to your plan and come up with ideas on how you can actually do it better. So for example, in our pictures here, we see that, the Elizabeth City responders are big help to us, but also the Coast Guard, which is just down the road from us. They land helicopters. They're teaching us how to load C-130s for natural disasters and supplies, things that anybody can do if they have the manpower. But the Coast Guard has actually just approached us and has asked us to do an AUP, an auxiliary unit program for the Coast Guard on campus, which actually gives our students another opportunity for a career field when they get done. And then when we start talking about this, we have to generate the enthusiasm. And you all know this in anything that we do in the university and college. The more enthusiasm that we have from our students, our staff, and faculty, the more successful we are. And so even through COVID, we've done a lot to try to motivate the students in how to do things and what to do. And students are result driven. If you can give them something to do that is meaningful, it means a lot. So for example, Mr. Burns just talked about some of the things he was doing with broadband. He actually allowed our students to participate with him, and our students did help in a North Carolina broadband project. And then we had a different group of students that actually helped with an economic development program that he was working on as well. And people think emergency management or CERT is only emergency and disaster related. But just like Mr. Burns talked about, if you don't have broadband, then you can't transmit a 12 lead from your ambulance to the hospital to save that person's life. You can't communicate with your disaster workers. You can't do telemedicine. Same thing with economic development. If you don't have a resilient community for disasters and emergencies, who's going to want to bring in their multi-billion-dollar industry into your area and set up factory there if every 3 years things get blown apart and have to be rebuilt? It doesn't work that way. So we have to generate that enthusiasm. And we have to generate it early. If we want our service workers to, in emergency services, to mirror our communities, we have to start getting people from the high schools and middle schools and even elementary schools to start thinking about emergency services is a field that they can be rewarded in both financially and personally. So the bottom picture down here, you see something that I'm very proud of. This is our Immerse program. This is a year-long camp for our 5th and 6th graders, and it's totally paid for. And we are actually combining STEM and emergency management techniques. So these kids actually, through the course of their year, will build a submarine that they program to do search and rescue missions underwater. They do rope rescue type of stuff. They do land navigation, a lot of different things. And we get to have some fun. So here you see them at Virginia Beach, the adventure park, and they're actually practicing their rope rescue skills, their team building skills up in the trees during the summer. And then the last important thing to remember is do not try to recreate the wheel. This stuff is already out there. FEMA has tons of resources. The CDP has tons of resources. We have tons of resources within the Workforce Consortium, and other people have done this stuff before. Ask. And again, remember the first rule up there, friends, you have friends, just ask and they'll be more than willing to help you. Next slide, please. So when we start talking about the CERT, remember the CERT is this big pool of manpower that you have to be able to pull from your university when you have something that you need to do, when you have a problem that you have to overcome. And so our CERT students have been teaching CPR, fire extinguishers. They've been teaching, you can see they're even teaching PET CPR, which is probably one of the biggest hits that we've had on campus. The students have learned how to drive fork trucks and they're licensed. They've had OSHA certified courses so they can work in points of distribution, giving out food and water and moving massive amounts of supplies. But COVID slowed us in a lot of things. One of the heartbreaking moments for our students was a field trip they had planned to actually work on loading C-130s with the Coast Guard for disaster supplies. 2 days before they were supposed to go, got halted because of COVID restrictions. But the students made the best of it. The students actually went through the Johns Hopkins contact tracing program. They got certified to be contact tracers if the university or anybody else needed them. Here on the far right, you can see that they actually are learning how to become fit testers. So this means that our CERT students can actually go ahead and fit test and train other people to use N95 and other required respirators by OSHA in order to be able to help organizations do what they need to do. Our students have had the opportunity to work with the Arctic Domain Awareness Center through DHS grants and be able to work with the drones. We have a massive fleet of drones, and our students have been able to figure out how to use those drones in order to be able to do damage assessments after the storms, in order to be able to save time and resources and be able to recover communities faster. And one of the things I'm probably the most proud of recently is the picture there in the middle where the students are in front of the TV cameras. So this class was an emergency management command and control class, mostly made up of CERT students. Ironically, all of these students were not emergency management students. And these students actually looked at the fact that the university wanted to do mass vaccinations. And they said, well, we can come up with a plan to do drive-through mass vaccinations at one of our buildings. And they came up with a plan. Now, not all plans work the way we think they would. So in this case, they had a wonderful plan. It was an excellent plan, but it was more efficient for us to use a third-party vendor. But the students took this in stride and they said, well, if we're not going to do mass vaccinations with this plan, we are going to change this plan and put it on file with the county, as this is a mass point of distribution for food and water during hurricanes or other natural disasters. So the university can be a central location to be able to distribute this stuff in a drive-through fashion using its CERT members and its resources that it has on campus. And so that is the kind of ingenuity, that is the kind of out-of-the-box thinking that we want our CERT students to be able to do in order to be able to help the university and our community. So I just want to do, on the bottom down there, you see I'm going to do 2 shameless plugs for our program. The first one is our Facebook page. If you want to see some of the cool things that our students are able to do and have been doing in the CERT program, please look at that. And then the YouTube channel down there is something that our students started last semester. They were requested by one of the local school systems that were supposed to do a virtual fair in person, but couldn't due to COVID. And so our students actually made their own YouTube videos, put them on this YouTube channel for the school system to use for their elementary schools children, teaching them about safety, preparedness, and resiliency in the fashion that we could during the COVID. So again, when we talk about CERT, we're talking about being able to help. And as a parting comment, I just want to say that Elizabeth City State University, we're here to help you start your CERT if you have any questions or in need of help. And the HBCU Workforce Consortium is working hard on behalf of you to encourage CERT programs in your universities in order to be able to better help our resiliency and our preparedness for disasters that are coming. And we all know that there's going to be more, and they're going to probably be worse. So Michelle, I thank you very much for your time, and I turn it back over to you.
Thank you so much. Our last speakers are from AmeriCorps, formerly known as the Corporation for National and Community Service. Rita Pratt, a lead disaster services specialist, and her colleague, Billy Udofia, Senior Advisor for Diversity, Equity, Inclusion, and Accessibility, will speak on AmeriCorps' programs and initiatives. I yield the floor to you, Rita and Billy. Thank you.
Thank you, Michelle. I hope everyone can hear and see me. Billy and I are thrilled to have the opportunity today to be on this panel of accomplished disaster services professionals and to speak with all of you about AmeriCorps and specifically our work in disaster services. Next slide. So first things first, who are we? What is AmeriCorps? AmeriCorps is the federal agency responsible for overseeing national service and increasing volunteerism throughout America. Those in national service, our members and our volunteers, are working right now to help solve communities' most critical problems: crisis, disaster response, public health, economic opportunity, climate change, racial equity, poverty, education gaps, and so much more. 250,000 plus people are serving in 40,000 locations across all 50 states and several territories, and millions more volunteers volunteer on their, on their own free time in their own schedule. National service members and volunteers range from age 16 to 65, and nearly 2/3 of those who serve with AmeriCorps are senior citizens. One of our biggest barriers to access is awareness about the AmeriCorps program. So let me start by asking, and you can answer this in the chat, how many of you have heard about AmeriCorps before? I do want to harken back to my intro by Michelle. AmeriCorps is a pathway to employment. I am an AmeriCorps alum. I serve with a disaster response nonprofit, and my eyes were truly open to the inequities in disaster services during that time. I had planned to go into a sales job after my term of service, and after that time, there's no way. My life was changed for the better, and now I work for the Disaster Services Unit. I lead the agency's engagement across the disaster services cycle with both federal and state federal and state partners, then local nonprofit and other partners. The Disaster Services Unit, as acts as a central hub for the agency's disaster-related activities to ensure that AmeriCorps engagement in this area is appropriate, consistent, and coordinated, which is really important in any sort of disaster response. So I'm going to pass the floor to Billy, and she'll talk about DEI&A and disaster specifically. Billy, next slide.
Thank you, Rita. I'm loving the chat. As stated before, I'm Billy Odofia, Senior Advisor for Diversity, Equity, and Inclusion and Accessibility at AmeriCorps. And I have to say that when it comes to increasing the number of Black and Brown individuals in the emergency management space, as well as increasing resiliency in Black and Brown communities, we know that volunteerism can have a major positive impact. Red Cross alone, volunteers constitute about 90% of their workforce. In 2016, Deloitte conducted an impact study that showed 92% of people who influence hiring decisions say that volunteering improves an employee's leadership skills and broader professional skill sets. Another 80% say that active volunteers move more easily into leadership roles. And in addition, 60 to 80% of jobs are found through personal relationships. I think Rita is a testament. I myself am a testament, both being AmeriCorps alums who are now working here, making decisions and being at the table in order to influence what the Corps looks like. So what does that all mean? Dr. Downer stated earlier that African Americans are underrepresented in emergency management positions. And what we know based on our analysis of our Corps in 2020 is that we've got some work to do. About close to 60% of our Corps in total and across programs is Caucasians, with Black members taking up about 20% and other racial groups even smaller, trailing behind. Our workforce data is quite similar. So when we talk about the great work of disaster preparedness, mitigation, and response that AmeriCorps does, and the correlation with volunteerism and employment, we know we have an opportunity to make a dent in these numbers, which means that, again, we have some work to do. And so what we'd like to do is understand a bit better the why behind the numbers. What are the reasons behind the barriers to entry as well as barriers to retention? What can we do as an agency to further diversify the Corps, which translates to diversifying the workforce, and in this case, the emergency management workforce? We've got some insight into recruitment and retention as it pertains to outreach as well as our benefits. And we've been able to have some traction in this area due to some increases with the American Rescue Plan. But we know it's deeper than that. And in trying to understand barriers to entry and retention, HBCUs can be a very strong partner in informing our outreach and retention strategies. In the interim, what are we doing? We're doing a whole lot. From an agency-wide level, we actually embarked upon a DEIA initiative last year where we assessed the agency in 3 different areas: fostering an equitable workplace, recruiting and retaining a diverse Corps, and promoting equitable grant making. We're looking at benefits. We're investing heavily in outreach efforts. We're fortunate to have 2 staff that sit on the White House Initiative for HBCUs, and we're strengthening partnerships across the country, most notably with our HBCU community. We actually held 2 roundtables with HBCUs in the southern region this spring, which hopefully will yield some direct sponsors and grantees. So we have some tremendous opportunities to expand efforts in Black and Brown communities, as well as service and job opportunities just by how we work together. I think funding from the American Rescue Plan, as I said earlier, allowed us to really put some of our recommendations from our DEIA initiative to action, increasing the Living Allowance Award, increasing formula funding for governor-appointed state commissions, providing additional administrative dollars to support a growing portfolio of programs, including disaster programs, expanding access to match replacement funds, which cover the grantee portion of the obligation most have been unable to fulfill due to the pandemic, and then, of course, launching planning grants to community-based organizations that are strategically aligned to local government priorities. In addition, President Biden's executive order on advancing racial equity and supporting underserved communities has given us bipartisan support to help us be better, stronger together, which I think is a perfect segue to my colleague, Rita, who can tell you a bit more about our agency's disaster resources. Rita?
Perfect. Thank you. That's great, Billy. So without going too in depth, let me tell you what we're doing right now. Hurricane Ida just blew through. That impacted several states across the nation. We have folks heading to New York, New Jersey, Louisiana, Mississippi. We also have the potential for a mission assignment in California for the wildfires. We just responded to the Tennessee floods. And this is all of our AmeriCorps disaster response teams, so not one specifically. If that's something your school might be interested in, if you have an AmeriCorps program, creating an AmeriCorps disaster response team, then you'd have access and you'd have the ability to deploy your members out to, these disasters specifically. But that being said, all of our programs increase community resiliency, access to food, mental health resources, education, job creation, tackling homelessness. These are all of AmeriCorps' focus areas. So these programs create a more resilient community, let alone our actual disaster programs. When we go into a community to respond to a disaster and they're packed full of AmeriCorps programs, we have resources there. We have people and members that we can call on to come and respond right there in their community. That's the kind of local response we really are looking to get more involved in. So Billy will talk about some upcoming grant opportunities. But the more programs involved we have, the more prepared and the stronger the community. Directly speaking to those who may be interested in serving, all programs have different capacities. So you can see here we have, FEMA Corps, AmeriCorps Seniors, AmeriCorps Vista. These are all different programs under the larger AmeriCorps umbrella, and they all have different capacities. And so depending on your skill set, you may fit into one of those programs better. So I would encourage you to go through our website, talk to some of our recruitment folks about what will work best for you as an individual and where you can best enhance your community. Billy, I'm going to pass it off to you for the next slide.
In the interest of time, we're going to go to the next slide. Thank you. So the big question is, where do we go from here? There are a plethora of ways to get involved with us and make a greater impact. One of the things I hope to see every HBCU signing up to be a school of national service. It's an opportunity to make higher education and continuing education more accessible for AmeriCorps members and alumni, giving you access to over 1.2 million AmeriCorps alumni and making college more affordable and accessible today. There's many upcoming funding opportunities. The best way for us to diversify the Corps is to be the one making the selection. Our agency does not make direct selections for members in many of our streams, except, in fact, only one stream do we actually make selections. It's our grantees who are responsible for the Corps when it comes to recruitment. So we talked about the COVID response earlier. I'm really excited to share with everyone here that yesterday, AmeriCorps released the Notice of Federal Funding Availability for Public Health AmeriCorps. It's a new partnership with the Centers for Disease Control and Prevention that will help meet public health needs of local communities and support the recruitment, training, and development of a new generation of public health leaders who will be ready to respond to the nation's public health records. We are really excited about this. There's a $400 million investment behind this. The project is anticipated to fund up to 5,000 AmeriCorps positions over the next 5 years. So when we think COVID response and whatever other response that's going to come our way, this is big. Grants are going to be awarded through a competitive process with the first competition expected in fall of 2021. Also yesterday, we announced our request for VISTA concept papers with an upcoming webinar slated for September 30th. And we have many other funding opportunities that I invite all of you to be the gatekeeper for, particularly when we're talking about making service opportunities available to HBCU students and alumni. And even if you're not, we definitely want you all to be a champion and bolster, at a minimum, the number of HBCU students and alumni who know about national service opportunities and jobs at our agency. Out of 3.2 billion Ed Awards that we dished out last year, 36.5 million went to 92 out of 102 HBCU institutions. We're also looking at 12,200 alumni just based on those numbers alone, but we want to increase those numbers. So we ask you to help us do better. Our agency has an unwavering commitment to diversity, equity, inclusion, and accessibility. We've allocated resources. We've made structural changes in support of recruitment and retention of a diverse core, our staffing, as well as our grant making. In doing so, we need to understand how we can serve you better and what are the barriers to our agency's resources and opportunities that exist. Because we know a core that is a representation of America is an ideal core, and we hope we can be better, stronger, and prepared together. So back to you, Rita, to close us out. And we can go to the last
Next slide. Yeah, go to the next slide really quickly. These are benefits of joining AmeriCorps as an individual. Go to our website and you can read all about it. And then next slide. Right there is our link to our website. And Billy and I are more than happy to answer any of your questions. Thank you. Back to you, Michelle.
Thank you so much, Rita and Billy. What an informative presentation that you've shared with our audience. I see the chat has been blowing up. I want to thank the panelists for jumping in and answering those questions that we're getting from the audience. I couldn't have asked for more. And we're nearing the end of this session. I have one last question I want our panel to think about. What can HBCUs do to make themselves more resilient outside of the things you've already mentioned? And in your response, are there any public and private partnership strategies you can recommend? And in addition to the resources you've identified, do you have any more that you can share with our audience? Okay.
I think, resilience for us it's in our DNA. We've been able to be successful, despite the meager resources that our HBCUs have. So one of the things I think for us to be resilient is the first order of business is really to measure campus resilience gaps, both at the individual HBCU level, at the regional level, and at a national level as a cohort of HBCUs. And then together we should work collectively to fill them and then expand on that blueprint for longitudinal success and sustainability. So as I said, resilience is in our DNA. Our partnership will be whoever wants to work with us. I think at this stage of the game, we're looking for like-minded people who want to advance the resources and opportunities for the community. And so like an AmeriCorps, FEMA, whomever wants to be here, I think we can say the tent is wide open for everybody who wants to come under it.
And I'll, if I may add, Dr. Downer, there are opportunities to engage with communities on a plethora of issues. One of the things that I wanted to point out in my presentation is that all these things are connected. The lack of access to broadband has a direct impact on health outcomes, has a direct impact on the ability to access emergency management personnel and access other services. So we have been working with schools. We've worked with Grambling. We've worked with Elizabeth City. We've worked with Stillman College to help address these issues in their surrounding communities. And that's part and parcel of what that notice of availability of funding opportunity is about. There are lots of chances to be able to get involved and participate to work with your communities to help address these issues and the fundamental infrastructure concerns that impact the ability to respond. The door is open, particularly with the HBC Emergency Management Consortium. We've got a wide array of tremendous professionals that we work with across academic, government, and non-governmental organizations, and we welcome the opportunity for you to reach out, join, and be a member, and find out how you can indeed take advantage of what we have to offer to help move forward.
And Michelle, I can't pass on a question for preparedness and resiliency. So I would say that, everyone here needs to start doing this at home so that we can carry it forward into our universities. So September is the National Disaster Month. So it's hurricane season. October is Fire Prevention Month. Hopefully everyone has a smoke detector in their home. Hopefully everyone has tested it. Where I normally run into problems with this when I ask this question doing preparedness speeches is how many people have actually done a fire drill in their own home. And so most people have not. And I ask them why. And they're like, well, everybody knows what to do in the event of a fire. But that's not true. I promise you, if you do a drill in your home for the first time, your children, your loved ones are going to do something you did not expect them to do. And that could be the matter of life and death. So practice this stuff at home. September, how many of us actually have a go bag? If you had to evacuate your home right now because of an earthquake, because of a tornado, because of a terrorist event, because the gasoline truck wrecked outside your house and put up a green cloud, do you have a bag that you can quickly grab that has enough stuff for you and your family to survive for a couple of hours or a couple of days? Have you thought about your pets? Are you taking your pets with you? Now, once you start thinking about this what if situation at home, you go into the university and you say the same thing. Have we done a fire drill at our university? Fire drills are not required in universities by the fire code because we are considered businesses. We are not considered to be places of education. But if elementary schools do fire drills, then why don't we do them in college? And then from there, it grows, it grows, it grows. I'm sorry. I'll stop. I'll get off my pedestal now. Thank you.
Yeah. I'll just add, really echoing what I said in our closing statements, partner with us, be the gatekeeper of our resources. Our agency is designed to do that. Become champions of national service. Incentivize service on your campuses. Promote service as an opportunity. The Education Award is a form of a scholarship. It is a way to pay for school. Service is a way to get a job. It's a way to acquire these skills and put you in the position to build relationships with those making those decisions. Like I said, again, we want to see everyone become a school of national service. Really, it's the ball's in your court when it comes to our resources. We want to partner. We are here. We have both competitive and non-competitive resources. We didn't get too much of an opportunity to talk about our National Civilian and Community Corps, but I know my colleague Rita mentioned FEMA Corps. So we've got a lot of great opportunities for you all to be engaged and partner and access this resource, and we're ready and willing.
Thank you. Well, we've come to the end of our program. We hope that the information shared with you today was useful. I want to thank you, panelists, for your insight and strategies to make our HBCUs more resilient, ensuring that they are better, stronger, and prepared. For more information about the HBCU Emergency Management Workforce Consortium, visit www.huttc.org. Thank you.